last 2 years. Well, what has happened to us? Well, we experienced a pandemic, and just think about how this pandemic that we lived through, and we experienced, and we suffered, and we cried, and all the things that occurred to us during that time period. How did that affect? And that's something, a question I'm going to ask you as an audience. How did it affect you personally? How did it affect? A little technical difficulties here. How did it affect you personally? How did it affect your family, people at work? I mean, just think about working from home. That's changed us. The stresses of working from home, and now getting through the pandemic, through our vaccinations and trials of the vaccinations, and coming back to work. Well, what's happened after that? There's been significant tragedy. Just think about it, back in Buffalo, the killings that occurred in Buffalo. How does that speak to society? And just recently in our back door, the poor families and children, innocent children that suffered this massacre. And how did that? Think about it, how did that affect you? What are the things that you felt when you heard that thing? I know it affected myself and my family, and gosh, my heart and prayers just go out to anyone that was affected, by that. And so, how does stress affect us is one of the topics, and how does stress affect our health? And health is really, think of health now in really many terms. It's not just body health, because it does affect our body health, but it affects our emotional health and our spiritual health. I have some statistics here of who we are in San Antonio, and this came out of USA Today. Adults with very little physical activity now, our city is about 28% of us. Adults with poor health or fair health, we're at 22.5%. What's the prevalence of diabetes in our city? Anywhere between 13 to 15%. Obesity, maybe up to 40%. And that's in part of, I think, of how we as a public, we as a people are fighting this battle with stress and emotion, and just we're being attacked in all different ways, and how it's affecting our body. Well, tonight I have a dear friend that's going to be joining us, Isabell Correa, and I've known her for many years, and she has helped me personally as someone that I seek guidance from, and many of my patients I've sent to her over the years. And all I can say is that she's helped people. She has a very good perspective, I think, that's pertinent to today and what we're dealing with, of stress and health. Hey, welcome, Isabell.
Hi, it's so good to be here with you in this way.
I know. I love that you're with us. And so, Isabell, can you tell us? I mean, I know you really well, but our audience doesn't know you. Can you tell us a little bit about yourself?
Sure. I have been in the medical industry now for over 30 years, and it's really, 30 years.
We're dating ourselves now.
A little bit, but that's okay. Wisdom comes with that, right? And so I've had an opportunity to see bodies and people strained under many circumstances, and some of it has been, in the orthopedic department, or it's been in rehab, or it's been in working with families and working with children. Working in rehabilitation for the Rehab Commission, and working with women's health. So I quite a broad perspective. And most recently, what I've been doing is I've been working in the trauma industry and bringing those elements together, the rehab pieces and the trauma components.
Just a question I'm going to ask you, and I'll put one in our eyes. Do you think that how would you define trauma, and how would someone define trauma, and what are some of the traumas that you think are affecting us now?
I would say trauma is an event that creates an overwhelm that is too much and creates a state of defensiveness that cannot be met with the resources, and it is overwhelming usually and leaves this hallmark of distress and strain over time.
So again, I'm coming from a different background. I know we've had a lot of discussions over our years of knowing each other. So if you ask a surgeon, trauma is a broken bone,
Yeah.
a torn muscle,
Yeah.
an injury to a nerve, an injury to a disc, and things I deal with patients. But you're saying there's more to trauma.
Yes, well, you're referencing physical trauma, right? The kind of trauma where someone has a car accident and has a broken limb and then comes to you and then needs repair. And that can be traumatic, but just personally, because you were my back surgeon, right? When you took away the pain as a result of the surgery and the exquisite way in which you managed the whole thing, not just the surgery itself, the act of sewing it together, but this presence, this ability to be empathic. For me, it was a resource. So an injury itself is not inherently traumatic. It can be restorative, like in my circumstances with you, and it could be a great transformative experiences. But there are surgeries that can be traumatic for some people because they lose function. Oftentimes we have surgery as a result of a catastrophic condition or an accident.
Right.
Yeah, but there are other types of trauma that we don't think of day to day. Sometimes car accidents bring those about, or a relational repair problem where a child or a wife or a person is experiencing abuse, or
I think that some of the physical things that I deal with are the healing, because we're healers. We heal people.
mm,
Do you think that although the body physically can heal with the cells and the bones and muscles and tendons can heal, that the patient can't heal without some type of other healing?
well, yes, because with trauma comes somatization often.
What does that mean?
Somatization means that the stress, the overwhelm gets locked down as a state in the body. It becomes nervous energy. The regulatory systems of the body don't function as well with shock to the body. And so this shock doesn't get repaired when the bone is repaired. It's held in the nervous system. And this held state becomes an inability to function 100% in the world. And sometimes it looks like you're not getting along with the world. Sometimes it looks like you're very nervous. Sometimes it presents as limitations and narrowing your ability to be in the world. And it can present as symptomology like anxiety disorder, claustrophobia.
I've seen a lot of patients that, and we see patients that are in pain and have problems, but I've seen them not have the coping skills that solve it. As I said, in our intro, I think we've changed as people with all the additional stress in our lives. And I believe that the patients before had better coping skills, or at least they managed their pain better. For instance, I see patients now act out where they didn't prior. And I see not just in my patient, but road rage or how people interact and just the general public. I don't think it's the same as it was before the pandemic.
Right.
What do you think about that?
Well, the distinction between shock trauma, right, which is what happens after an injury or assault to the body, or developmental trauma, which is something that happens in childhood that creates ongoing distress patterns, is this collective trauma that since the pandemic, and with huge events that are global or collective, we are seeing more and more of. And what we're seeing post-pandemic is an increase in violence. It's an increase in addiction, an increase in divorces. We're seeing this collective way in which the overwhelm of being isolated, of not being able to access resources.
We were isolated. So think about it. The only way we interacted, during our isolation time period was like we're doing today. I mean, we had, of course, our family and close ones with us, but this was social interaction for a very, very long time. I mean, this was it, and this is not human at all. Talking to you, I love seeing you and talking, but this is not a human interaction. It'd be a mechanical, electronic media. That's not the same.
It's not, because humans are wired to connect. At birth, the first thing we do is we seek out our human, we nestle, and then we thrive. In separation and isolation, we become more distressed over time. So proximity to others, safety in groups, in communities, in one-on-one are necessary for a nervous system to function optimally.
Sure. How do you think now, going back to, the stresses in our lives, how do you think that's affected us physiologically?
Well, there are standard physiological responses to the kind of distress patterns that we've had, and they show up through the autonomic nervous system, the part of the nervous system that runs the things that we do without thinking about it.
It's that background computer that's always running that keeps us going.
That's right. It's the turning without having to think about it. It's the reaching, it's the hunger, it's the sleep. And so it dysregulated us in various fundamental ways. Sleep dysregulation, which is necessary for healing, distress patterns with anxiety, autonomic dysregulation that shows up as distress in the body, fear responses, increased anger, shutting down, depression was another, and an inability to really.
I'm sorry. How about hormonal changes? Are you aware of any hormonal changes that occur to us?
Well, the hormonal changes are part of that stress response. So if you think of stress as a shift in the way that we function autonomically, then what happens is we get what we call metabolic response changes in the system.
That's beyond our control, right? That's happening to us as a reaction to our environment. And
that's right. The stress response creates chemicals that are excitatory, that are inflammatory, that create distress at the cardiovascular level over time.
We do know that inflammation can cause cardiac damage. Is one of the precursors of some people thinking of cancer.
Yes.
Inflammation and can be detrimental to healing. And there are a lot of things that inflammation is bad for.
Exactly. And these inflammatory responses are not due to something we ate or something that we are, putting in. It's the physiological shifts as a result of the distress and reaction to the environment and what we perceive as lack of safety in the environment.
Sure. We've had long discussions over our years of knowing each other, of looking at the body and looking at our patients, from different lenses. Certainly I've tried to understand your lens and you try to understand mine. But I think that's important that, as we do give care to our patients, if we do look to heal our patients, that we do have these different perspectives. What are your thoughts about that?
I deeply appreciate what I encountered with you very early on as a fellow therapist, working in the health industry, was that you had a very broad way of holding how to support patients clinically and looking at them other than, somebody who needs repair. because human beings need to be able to be seen, to be met where they are, to have a kind of a relational connection to the practitioners that are taking care of them. And
that give us is extremely important, you know. I mean, that trust, that relationship that we build with our patients, you know, I hold to the highest of regard, and I'm honored that they trust me to try to guide them and help them and really nurture their recovery.
yes, and we know that people who feel safe with their practitioners tend to respond better pre and post surgery because their nervous system can settle. So a healthy, what we call attuned, someone who's present and engaged and cares, that caring other makes a difference in how not only surgery responds, but how they feel about themselves. And it literally changes the physiology. Literally, we create hormones that are not just excitatory with distress, but hormones that help us to settle.
Sure.
Dopamine that allows us to settle when we are with another or in a setting that supports it.
So, there are many patients that you, over the years, I've sent to you that have been broken in many different ways, and not just broken physically, but broken in many facets of their life. And what I've really enjoyed is seeing how I've identified you as someone that I can send the patient to that can help them heal. And many of those patients, Isabell, never have to go to surgery. Can you give me some insight of how you do that?
Well, because, let's see, first of all, it's important to say that there are lots of other practitioners who do this really well. And I think that what you've noticed in this work, and I think we share this too, because I see this in you, is that we're present for the patient. We're really attuned to their needs. We care. We care about what their need is. And then for me, specifically in terms of my skill sets, what I've done is over the course of time have studied methodologies that allow me to assess and be with someone who's in high distress, who's dysregulated physiologically, but also emotionally and psychologically. And I don't think you can separate them out. You can't.
No, I don't think you can either.
Yeah. And you have, I think you do a very beautiful version of that. Even though you're a surgeon, you're very attuned to your patients. You listen, you spend time with them and you listen. You remember.
I get in trouble for my staff for doing that, you know that.
Huh?
I get in trouble all the time for my staff for doing that.
I know. we both run late that way. But the truth is that people need this, especially after isolation, especially after the kind of violence that we're seeing culturally, and especially because really we don't have really good solutions day to day when the whole world is struggling, right? War.
Are there some things that you can give us, you know, and this is just not only for me, but for all of viewers who are watching, are there some tools that you can give us?
Yes.
What are some of those tools?
I'll share some with you. The tools that I have to offer come out of what we call the somatic therapy world. And that just means soma is the Greek word for body. And the premise is that the body holds all the information, not just the mind, not just emotions, not just behavior, right? But also what creates the responses physiologically that we use day to day, but also the things that have occurred, our past, our wounds, our fears, all the ways in which human beings suffer, that it all gets laid down, and that we can, through a series of methodologies impact their somatic state. And it has to do mostly with presence and with helping redirect attention and awareness about what does work and is functional. It's also about addressing the shock. And I think this is where you're seeing that my work is different from other therapists who are great practitioners.
For instance, some take-home messages or skills that you can give our audience that,
Yes.
Because it really is not just, it's something that's, I look as a journey, as a process, that to get to this wellness state. And we'll talk about that later, but this wellness state that you and I believe we need to get to. And there's ways that we can get to that area to enjoy that in our lives. But there's some take-home messages you can give our audience to start that. So if I'm at home, I'm listening to this, and I'm having problems, and you're like, hey, some of the things you're telling me, I am feeling different than I did before. Yeah. And I'm not, maybe a little more snappier than I was, or maybe I'm not dealing with my job the same way. I'm not as happy as I once was.
Yeah.
Are there some things you can give us, from your perspective, to start this journey?
Yes, and I think that being with family and being with people who feel safe, being with friends, is integral. Social, what we call social engagement, is one of the components of wellness. People who are suffering and are having difficulties, they tend to isolate. But when you are able to turn to a friend, when you're in distress, or come into a community, or maybe are a member of a greater community, we know that there's healing in that. And with that, it's not just the idea of healing, it's that physiologically we settle. This is why babies reach for their mommies when they're distressed. So when we are with each other, we settle. So finding what we call an opportunity to tend and befriend, to be with those that feel safe, is integral to that, or a group that feels safe, where you can be heard and known, is important. Another thing that is important is to find activities that allow you to mobilize all the tension that you're holding through exercise or walking or yoga. In order to mobilize the stress, the exercise has to involve the extremities. It has to be mindful and attuned. And it also has to involve movements that allow you to be aware. So,
it affects us in many ways. The physicality, just not the physicality of doing an exercise is important. There's a lot of things that occur, with exercise, which are endorphins.
Yes.
Endorphins can help us in many ways. It's that feel-good substance that we make that kind of keeps us going. I also feel there's healing benefits of endorphins too that heal us. And you're right that mindfulness of exercise is important. I'm guilty. I'm currently back from my health kick, and I came back from vacation and enjoyed my vacation. But now it's time to get back to being healthy again. So I'm engaging in my exercise routine, eating better. That's the question. How do you think eating affects us? And are there things that, although I enjoy, are there some things you would advise me to stay away from in my journey towards wellness?
Well, we know that high fatty foods are not good for us in terms of heart disease. They're tasty. They're very tasty. The studies have shown that the Mediterranean diet is well known to support longevity. And it has, it's made up of green leafy vegetables and lots of a variety of vegetables, legumes, fish, some protein, like, flesh and
protein is important.
Protein is important.
One of the things I recently came across was that the Roman gladiators and and the Roman soldiers and Spartans had a very much of a Mediterranean diet. They did have protein in their diet, but it wasn't a high protein, low carb diet. It was protein was a part of their diet, but you're right. They sought their protein from other sources. It wasn't meat protein, so let's say it wasn't meat protein. It was other types of protein, and they had a very much of a Mediterranean diet that the Romans thought was very promoted health and strength. So that was interesting.
So protein and also healthy fats like olive oil.
Right.
And so the Mediterranean diet allows you to eat a lot of the healthy foods without creating that spike in inflammation. And your system can digest it.
Avocados is another good fat.
Avocados is a great essential fatty acid that is healthy for you.
That lends into a nutritional discussion of how, and I want to just ask you the question, how do you think that nutrition changes us in some ways? I'm thinking, boy, these micronutrients and the right nutrients are really good, not only for maintaining health, but also restorative. What are your thoughts?
They are. And what we know is that now with the studies around biomes, right, those little critters that live with us that make up a large part of what we are and the things that we crave, that if you feed your gut healthy foods like the Mediterranean diet, foods that are not high in sugar, foods that are not high in fats, and a variety of foods, a variety of fruits and vegetables, that your biome, your gut functions better. And so digestion becomes easier and assimilation becomes easier, and therefore this idea of wellness, right? We become what we eat. And if you eat food that's rich in dense vitamins, you're going to feel better and you're going to live longer.
You know, recently I learned that we may have up to 3 pounds, I couldn't believe it, 3 pounds of bacteria on our body, but in our body.
Yes.
I heard that and I was like, what? And I'm like, that's insane, but it's true. And it's been shown that by feeding our good flora or bacteria, right, it can increase our immune system.
Yeah.
It can include wellness. It can include our even some thought process of mental health.
Yes. In fact, they're looking at that now and they're seeing that sometimes a bad gut, as it were, a gut that's struggling, is also a nervous system that's struggling and a mind that's not focused.
Right.
So, yeah, the biome is really important, and more research is in development because they're seeing that it applies to everything. In fact, we get our biome at birth.
Oh, we do. There was a whole study between children that are born
vaginally,
or people that are, and the study showed that their flora is different.
It is.
And it starts from the very, very beginning and even how the 2 babies can assimilate nutrition that they're given and their nutritional needs, and it's it really, and actually back in some times it led to babies being fed things that would promote gastrointestinal flora.
Yes, and the cholesterol that the mother lets down also contributes to this development of the gut flora. So these are important pieces. And when you're under stress, your inflammation spikes, and a counter to that is not just stress reduction, but the right diet. And when the gut flora is healthy and stable, it creates an anti-inflammatory state holistically.
It's interesting, I'm a surgeon, and we're talking about these things.
I
And
know.
it goes to how you and I have talked about healthcare and wellness, and I'd just like to say, that to our audience of this is the focus, these kind of topics we're talking about, and the focus of how we're starting to develop this wellness center. And the wellness center is a very catch-all term, but we're looking at as you and I have talked about, encompassing many different aspects, and I use lenses, because we all have different perspectives and lenses that we're coming toward the healthy patient. So can you talk a little bit about that, what we're developing?
Yeah. So this idea of an integrated model of wellness, right? Like a wellness model is really significant in that it provides various lenses to keep supporting wellness. So wellness, not just from a diet perspective, it includes education around diet. It includes education around stressors and stress reduction. It includes using modalities such as you have historically done a lot of outreach to various organizations, but more and more there's an in-house where acupuncture and touch therapy, it works. I just got some 2 days ago for my back. So yes, it does work. Yeah. So modalities like acupuncture, referring out to those that are doing physiotherapy and other wellness practitioners. We're looking at diet, we're looking at stress reduction, we're looking at trauma and the various effects of trauma. And we're looking at resiliency and what creates resiliency.
Remember we talked about the 3 R's in the core and goal of our center. What were they again? There was resilience.
Resiliency. The second R was resources and restoration.
Restoration. The other thing, just kind of FYI, coming online with our program now, we're in development of a yoga program for our patients. So a lot of things that we look at. So patients that come to see you and we're not I would say we're not the typical, we're the atypical, I think, doctors, because we look at many different things for just the healing of patients.
I think we're the future. I don't even think we're the future. I think in some ways we've been ahead of it for a while now, because we've had these conversations for years and you've outsourced it and I've been a part of it in many ways. But collectively, I mean, in this moment, the center really represents this kind of I don't want to use the word holistic because it's much more than that, but it's really an amalgam of the best, most recent science-based examples of what wellness and how wellness happens. We can't just treat broken legs.
We're not talking about studies, and we're talking about even going into clinical studies together and looking at our measures, our interventions in patients, and utilizing these tools and actually measuring results. And this is a study you and I talked about that we're going to start doing.
Yeah, and this whole idea of coming out of the pandemic, and I just have to, like you, say that Uvalde was so shocking to our community because it was right down the streets, and we're doing outreach to that. You know, I've been doing some work with the Ecumenical Center to talk about a trauma-informed lens that is oriented towards how to bring resiliency back. And so this idea of resiliency is really important because it's the overwhelming experiences in life that begin to create a habitat for illness to take hold. And so this idea of resiliency and wellness, they're paired. Resiliency and safety are paired. Resiliency and this humanistic engagement with someone who is suffering, it creates this healing effect. And we know that, I think we're all headed in that direction.
We are, and it's exciting that you and I talked this for a very long time, and now we're actually putting it together, which is exciting, you know.
Yeah.
And one of the things I want to say is that it was thank you for coming and joining with us tonight. this is going to be one of many talks that we're going to have, and we're going to have other guests. We were supposed to have another guest, but he couldn't make it. He was in surgery today, and that helping another one of his fellow patients he's taking care of. But these are things that the initiative that we've started that's continuing to grow momentum, I think is important for our community to provide, support and healing to not only our community, but our patients and outreach to people that need us.
Exactly.
So thank you. Well, thank you.
Well, thank you for having me. It's been a pleasure, and I'll see you in the clinic.
I'll see you in the clinic soon. And so for our audience, this is just one of the facets or things that we do in our clinic. We're going to highlight other things, and of course, I'm going to invite Isabel to come back and speak and give her some of her words of wisdom and some perspective of some of the initiatives that we're doing here in MD Spine Care. And thank you for spending some time with us today. There'll be more programs. We'll let you know when they're coming, and our topics are going to be varied. We're going to be respectful of any questions that come to us and any topics that we think we need to talk about. We will bring that up and discuss it frankly and honestly with our audience.
Yeah.
So, we have some questions actually. You ready for some questions?
Sure.
Okay. So I guess there's two parts there, right? There's parts. Is there a perfect way to lose weight loss, and is there a too much weight loss? Is that the question? What do you think about that? So, because of too much weight loss, you think that there's an ideal. We have an ideal weight, and if we go under that, could there be some problem?
Yeah, I think that each person has this kind of a sense of what their optimum weight is, and sometimes it gets distorted with distress, right? Like you put on too much, or you keep going, and it no longer looks like healthy dieting. And so it's important that if you're going to go on an important weight loss program, that you also get input from someone who's guiding the process, especially if there's obesity. That's a very important clinical question, right? With obesity, it really needs to be monitored over time so that it's done slowly and healthy. And along with any weight loss program, if it's a significant amount of weight, let's say over 20 pounds, you really need to have some feedback from a professional who's also including an exercise routine and really managing diet.
I think it is. And those are the patients that I want them to come to us. And we have the resources within our center to help those patients. Because I don't think the answer is one diet and one way is the right for everyone.
It has to be tailored.
That's where we can develop the individual plan for the patient and guide them along this journey to weight loss and wellness and that better lifestyle and functionality. So I'm on my journey, and I know that I'm excited to see where I go. But my plan may be not right for you, and may not be right for one of my patients. So that's where we customize our plans for our patients. So at this point, I gotta say thank you very much, Isabel. It's been great.
Thank you.
I can't wait to be in the clinic and we can talk some more about our patients. And thank you everyone for joining us tonight. It's been a pleasure, of course. I hope that you've enjoyed some of our conversation. It's important. I learn something every time I talk to Isabel. And so at this point, good night from MD Spine Care and Wellness. And we will see you again sometime.
Take care.
Good night.